Hey caregivers, welcome to today's essential guide on feeding practices for infants and toddlers. Let's dive right in. First up, let's talk about infants, the little ones aged 0 to 12 months. During the first 6 months, it's all about exclusive breastfeeding or formula feeding. Breast milk is packed with essential nutrients, antibodies, and enzymes crucial for growth and development. But if breastfeeding isn't an option, formula is a great alternative. For newborns, feed them on demand, typically every 2 to 3 hours. A typical breastfeeding session lasts about 10 to 15 minutes per breast. For formula-fed babies, aim for around 2.5 ounces of formula per pound of body weight per day, divided into 6 to 8 feedings. When they hit the 6-month mark, it's time to introduce complementary foods. Keep breastfeeding or formula feeding, but start adding iron-fortified cereals, pureed veggies, fruits, and meats. Begin with single-ingredient purees like mashed sweet potatoes or applesauce. Introduce new foods one at a time to watch for allergies. Now let's move on to toddlers, those energetic explorers aged 1 to 3 years. They need a variety of foods to get all the key nutrients like iron, calcium, protein, and vitamins A and C. A balanced meal might include lean meat or beans, whole grains, and a serving of fruits and veggies. For calcium, think yogurt or cheese, and for iron, go for fortified cereals or lean meats. Establish regular meal and snack times. Offer a variety of healthy foods and avoid forcing them to eat. Be mindful of portion size since toddlers have small stomachs. Encourage self-feeding to promote motor skills and independence. When it comes to feeding practices for infants, ensure proper breastfeeding techniques. Make sure the baby latches correctly and monitor for signs of adequate intake, like steady weight gain and frequent wet diapers. If a mother is concerned about milk supply, suggest breastfeeding more frequently or pumping between sessions. For formula feeding, follow preparation instructions carefully and sterilize bottles and nipples before use. Demonstrate the correct formula-to-water ratio and emphasize the importance of using clean utensils. As babies transition to solids, introduce new foods gradually. Start with iron-rich foods and slowly add new items to monitor for allergies. Avoid choking hazards by preparing foods appropriately. Slice grapes into quarters and cook veggies until soft. For toddlers, encourage healthy eating habits by offering a variety of foods from all food groups and modeling healthy eating behaviors. Instead of sugary snacks, provide fruit slices or whole grain crackers. Promote self-feeding with child-sized utensils and let them feed themselves to develop fine motor skills and independence. Common challenges include picky eating and nutritional imbalances. If your toddler is selective about foods, offer a range of options and keep meal times pleasant. Avoid pressuring them to eat. For nutritional imbalances, consult a dietitian for guidance on supplements or alternative food choices. Regular growth monitoring is crucial. Track their growth through regular checkups and assess weight, height, and developmental milestones. Use growth charts to compare patterns and adjust feeding practices if necessary. Provide parents with guidance on feeding practices, portion sizes, and healthy food choices. Address any concerns or questions they may have. Remember, effective nursing care for infants and toddlers involves understanding their nutritional needs and using appropriate feeding practices to support optimal growth and development. Tailor interventions to each child's needs and monitor their progress to ensure a healthy start in life. Thanks for watching. Don't forget to like, subscribe, and hit that notification bell for more helpful tips.